Well, good morning and welcome to the Aesthetics Show. We're on live TV right now, and I have the pleasure of having Dr. Sachin Shridharani, a board-certified plastic surgeon on the Upper East Side in Manhattan, Fifth Avenue. As we're going to speak today, we're going to speak about different types of fat reduction. Dr. Shridharani, share with me, if you could, what brings you to the Aesthetics Show?
Well, Jay, thanks so much for having me here. I think the Aesthetics Show is bar none one of the most premier aesthetic meetings. I love the multidisciplinary approach, talking about technology meets surgery. So what brings me here is I'm on a panel shortly, and I'll be giving a talk on my signature treatment for surgery and a syringe for body contouring. So I'm here to learn from my colleagues and to hopefully share some great information.
Good. How many times have you been to the Aesthetics Show before?
It's actually my first time here. So
welcome aboard. We're proud to have you as part of our faculty. Okay, so with all of the different weight reductions, body contouring procedures out there, what is your number one go-to type? Because knowing you are in the Mecca, one of the Meccas between Beverly Hills, Manhattan, Fifth Avenue, what allows you, with all the different types of patient bases that we have, for you to choose the type of procedure that you feel is best with your patients? Because no two patients are alike.
You said the most important thing, which is no two patients are alike. So a big part of our practice is really giving patients an incredible experience. Every new patient consult really revolves around understanding the patient's goals, their expectations, understanding the downtime associated with it. In reconstructive plastic surgery, we talk about the reconstructive ladder, or working our way up to a more aggressive treatment. In aesthetic surgery, I think there's also a very similar aesthetic type of ladder where we can start with non-invasive devices through minimally invasive injections, and then all the way up to the appropriate surgical outcome. Each one has its pros and cons, as we all know, and for me, it's really understanding what that patient says to me and what they expect. If they're expecting a totally contoured, bespoke look, tailored down to the millimeter, a device may be challenging to achieve that. If a patient comes in and says, I'm phobic of surgical procedures and I'll tolerate a nice improvement, a nice modest change, but at the end of the day, like, I can't have something else, we're going to want to stick with something that's more device.
Now, as a board-certified plastic surgeon, and I deal with many of them, your number one usual go-tos are surgery. I mean, you became a doctor, you went through general surgery and became a board-certified plastic surgeon. How do you differentiate when a patient comes into you to be able to meet and exceed their expectations by using a non-surgical device when they come to you? And there are so many providers out there that are non-core in this industry today. Most people come to a board-certified plastic surgeon to have plastic surgery. How do you differentiate that from your competition in Fifth Avenue?
Well, again, I think one of the biggest components is I love to spend my day in the OR. I did train to become a surgeon. I love surgery. We have the benefit often that by the time the person comes, the patient comes and is coming to a plastic surgeon, they've already sort of pre-selected that they are likely okay with surgery. Or now and more what we're finding are patients come in and say, I want your expertise as a surgeon of understanding the anatomy, but I'm still opting for something non-surgical. Can you distill down for me what you can achieve without surgery, but applying your clinical acumen? So that's what differentiates us, is a surgical approach to non-surgical modalities as well.
With all the new devices that come out, now I've been in this conference here for 9 years, right? From the inception, from the very beginning. And I see radio frequency, I see cryolipolysis, I see syringe-assisted liposuction. I've seen all different types, and every time I go to a new conference, and I lecture at many of them, I see a new device. How do you, as the clinician, keep on top of all these devices for you to choose which one is best served for your patients?
Data is everything. I'm big on the science and I'm big on the data. So for me, what's really important is I love to see like a systematic review of the literature. I love to see randomized clinical trials, number one, because we take my background at Johns Hopkins for nearly a decade. We distilled everything down from the science and applied the scientific rigor to helping our patients. So we do the same thing in aesthetics also. So I'm going to look at the data on a new device. I'm going to look at what that science shows. I'm going to look at what my clinical trials will show us, and then I'm going to take that and then extrapolate it to actually helping my patients. But there are a lot of treatments and a lot of devices. You can't have every single one in your practice, otherwise it becomes a graveyard for technology.
Of course.
So you've got to basically say, okay, well, you know what? I'm finding tremendous improvement with cryolipolysis. Now I'm going to help accentuate the muscles by applying some muscle strengthening as well. So I think multimodal approaches are the way of the future. There's no one device that's going to do it all. So we're going to use different technologies to burn the fat and then stimulate muscle to really help the overall ideal aesthetic.
You bring up a very good point, because when you do a surgery, you usually know if you do a tummy tuck, if you do a breast augmentation, you're probably not going to have to do another one for many years to come.
We sure hope not.
Right. With these modalities that come out, and knowing that it's a newer modality that comes out the following year, data says everything. But what do you explain to a patient about the long range effect when many of these machines haven't been out long enough to really do the trial, the sniff test to say, what's my result going to be 3 to 5 years from now, when these machines, some of them have been FDA cleared, but haven't even been out 3 or 4 or 5 years?
So that's a really important question, because we do clinical trials in our practice. We have great partnerships with a lot of the major pharma aesthetic companies and help do these clinical trials and bring treatments to fruition. I think, again, it's very much about transparency, right? So patients need to understand that, listen, this is tried, true, and been around for 10 years, and I've got great data on it. This is a new treatment, it's a new shiny penny. I know you're excited about it. I know you've seen all sorts of great stuff on social media about it, and I know that you're thrilled because what one of your friends underwent. Let me explain something to you though. You're going to we don't know what this is going to be like at 3, 5, 10 years. We know it's FDA cleared. We know it's gone through the rigors that I can keep you safe, which is the #1 important thing. But if you're talking about longevity, you may not have that. Now the patient is in control and can say, thank you very much, Dr. S. Really appreciate that. I do want to try it because you told me you're going to keep me safe, and I guess I'll deal with it if it doesn't last as long as I was hoping, because I know you also gave me all of my options. Remember, we have the ability, it's the old adage, if you only have a hammer, the whole world is a nail. So if we can offer surgical intervention, which we have tons and tons of data on, if we can offer surgery in a syringe, which we have a tremendous amount of experience with, and if we can also offer devices, it makes us comprehensive, and we're not going to push the agenda of one specific treatment, it's pushing the agenda of getting a patient a specific outcome.
This is great, because with all the devices out there, and with all of your surgical skills, I have an old saying that with 100% of your skill, you may only possibly get a 50% result, because the other 50% lies on the compliance with the patient, right?
Absolutely.
Do you ever speak to the patient about lifestyle change? You can be the best magician as a surgeon and contour their body, but if they don't have a lifestyle change and a commitment to keeping that weight off and the contour of their body, they'll be back to see you again and again, and almost make it seem like all the professional skills that you did for them didn't work.
Well, that is so important, because across the board, what we find is that it's those lifestyle modifications and a comprehensive approach to patient care that makes a huge difference. So when we're again doing our intake, we meet with our patients 2 to 3 times before any surgical procedure. We have gotten to know this patient so well that we're understanding, is this a single acute lifestyle event that led to some weight gain? Is this a chronic condition and they've struggled with this their entire life? Whatever is going on for them, we know before we get into the OR or before we start engaging in these procedures, where are they BMI-wise? Where are they from a stability standpoint? Where are they from 1, 2, and 3 years ago, and where are they headed? And then we can offer them ancillary services. So we partner with an excellent nutritionist. We have an amazing group of personal trainers, like across the board. We even have stylists that we partner with. So once the transformation's complete and their body fits to where they want, now they have the ability to go dress the way they want to.
I think that's a very important part, and that was really what I was getting at, because after you're done with all of your magic, then it's really up to the patient to have follow-up and continue care to keep the transformation of their body. In the last 30 seconds to a minute, how about you would like to summarize what you best believe the wave of the future in this is?
Yeah, I think that the future of the aesthetic space is definitely going to continue to be less and less invasive types of treatments. Again, I love surgery. I spend half my week in the operating room and the other half of the week doing aesthetic non-surgical treatments as well. But I think the technology is only getting better, the outcomes are getting better, and we're starting to apply multimodal in a way that we've never done before. And I think that's really going to be the future.
Ladies and gentlemen, Dr. Sachin Shridharani, It has been a pleasure speaking with you and knowing that the future of aesthetic cosmetic medicine in the hands of skilled professionals are the wave of the future. Please allow me to welcome you as part of our esteemed faculty, and thank you so much for taking part of your morning. I know you have to run. I know you're on another panel. We wish you all the best and welcome aboard with us.
Great, thank you. It's an honor to be here, and thank you for a great morning.
Thank you.
Take care.
Great.